So hi everyone, my name is Dr. Gilad Rabina. I'm from Israel and I'm working at the Tel Aviv Medical Center. And this is affiliated to Tel Aviv University. And I would like to talk about today a study we just did and published at Retina. And this study deals with what happened when you stop treatment for more than 1 month. So we took the patients from 2019 and compared them to patients that were treated in 2020, and we compared them. And actually, we took them month by month, and we saw what happened during the COVID-19 lockdowns. And we tried to see if there's any change in visual acuity or in the pattern of treatments. And what we saw that in 2020, patient got one injection less than 2019, but amazingly, we didn't see any change in visual acuity. So then we divided by month, and we tried to look for a pattern if there is any difference between March, April, May, during the major lockdowns. And we saw that there isn't any difference, which was a very big surprise because we thought that we'll see a lot of people that lost vision during that time. But apparently, for a patient that previously treated for AMD, it doesn't really matter if you stop for 2 or 3 months.
Was there a difference in the findings depending on how many treatments were given prior to the delay of treatment for more than a month?
Yeah, we didn't take any naive patients. We took only patients that were treated before, previously treated with at least 6 monthly injections. Most of the patients were treated with treat and extend, and I think the average was 8 weeks between injections at the time or the period that we did the study. But we had patients that normally would treat every 6 weeks, 8 weeks, but at this period we treat them every 16 weeks because of the lockdowns. And we couldn't find any change in vision. Of course that any individual can experience a decline in vision, but in a large cohort, I think that we had around 1,500 patients, which is pretty much. We didn't see any major change in vision, which is good news. It means that if someone is sick or, I don't know, something happened to him for 2 or 3 months, it will probably be okay not to get the shot.
Do you think that these findings will change the way treat and extend is done in the future?
I feel it's still not safe to prolong the injections. I think that monthly or treat and extend are still the best ways that we have to treat patients. Although it's a large cohort, but it's not a huge cohort. So we experienced it only on 1,500 patients. I don't know what will happen on 50,000. It probably.
Were there instances where the delay in treatment had negative effects on the vision?
Yeah, we tried to see if there's any. Actually, we divided patients to groups. For patients that kept their visual acuity, a decline between 0 to 2 rows of Snellen and visual acuity, and 2 and above. And we didn't see any difference between the groups. I thought initially that will be a huge difference in the group that declined, like submacular hemorrhages, but we didn't see anything, which is pretty amazing. I think that it's super important to get the shots at time, to come and see your physicians, get your treatment.